computer is picking up a strange signal. Here, sir, you better take a look at it.
Hello, and welcome to episode 149 of Life Through a Prism with your host Rob Tierney. We're going to look at an article regarding disability from abc.net.au entitled People with Intellectual Disability Continue to Receive Substandard Healthcare as Program to Train Doctors Risks Closure by National Disabilities Affairs reporter NasCampanella under Specialist Reporting Teams Mary Lloyd, dated Wednesday the 3rd of June 2026. The day Sam Stubbs decided he was so unwell he needed to go to hospital was the day before he was due to do a triathlon. And right up to the point that his parents Chris and Deborah took him to their local emergency department, he was insisting he could still race the next day. The 27-year-old trains several times a week, plays for his local Australian Rules Football Club, and has seldom missed a shift working at the local bakery. So when a staff member at the hospital asked his parents about Sam's quality of life, they were taken aback. We felt as though we needed to prove that he has a good quality of life, his mother Deborah Jeffries told 7:30. We were shocked, his father Chris Stubbs said. Desperately worried about their son's deteriorating condition, it dawned on them the question had been posed because Sam was born with Down syndrome. When they inquired whether the fact was being used to triage him, the couple say they were assured the medical team had established that Sam had a good quality of life. It felt like we were being told, "It's okay, he's worth saving," Deborah said. What keeps me awake at night is thinking if we weren't there, what would have happened, because Sam wasn't able to talk. People with intellectual disability experience more than twice the rate of avoidable deaths compared with the rest of the Australian population, according to research from the University of New South Wales. Those studies show better healthcare could have prevented 38% of deaths experienced by people with intellectual disability, when it was 17% for the rest of the population. I've seen examples of stark neglect in healthcare experienced by people with intellectual disability, said Professor Julia Troller from UNSW's National Centre of Excellence in Intellectual Disability Health. Sam almost became one of those examples after picking up a respiratory infection. "I was scared," Sam told 7:30. "I had gunk in my lungs and I couldn't breathe." Deborah says Sam initially presented to a doctor with a temperature of 40 degrees, but because he tends to push through a feeling unwell, the doctor did not recognise how sick he was. When his condition rapidly deteriorated, Sam decided his parents should rush him to their local emergency department. "I was worried," Sam said. It wasn't long before he was transferred to St George Hospital, where he spent 11 days in the intensive care unit, receiving treatment for a collapsed lung and several lung abscesses. Include me in decision-making. Following grave revelations at the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability, the federal government recognised the urgent need to improve the standard of healthcare people with intellectual disability receive. In 2021, then Health Minister Greg Hunt made a commitment to promote access to comprehensive health assessments for people with intellectual disabilities and to improve training for healthcare workers. One of the initiatives to achieve this is the Health Ambassadors Program, run by Down Syndrome Australia, which arranges for people with intellectual disability to train medical students and mid-career professionals. In February this year, in a letter to Down Syndrome Australia, the government said funding for the program would not be extended. One of the people who would lose her job if the program folded is Emily Porter, who works there as a health ambassador. Emily and her husband of 14 years were born with Down syndrome, a genetic condition that results in physical characteristics such as low muscle tone and intellectual disability. She has good and bad experiences in the healthcare system, which she now shares at her presentations. She speaks fondly of her orthodontist, who she said took the time to carefully explain procedures to her. As an adult patient, doctors should speak to her during consultations, not to her. Support person, she recently told a room full of nurses. "I'm a grown woman. I can make my own decisions," she said. "When you include me and check that I understand, you will do your job better." Standard training for medical students includes only a small component about people with intellectual disability, according to Daryl Steff, CEO of Down Syndrome Australia. He said poor outcomes can be prevented by training medical staff to centre people with intellectual disability in discussions about their healthcare. The Health Ambassador program goes a long way to addressing some of that, and it will be a real shame to lose that, he said. Emily wants healthcare professionals to take extra time to find out what makes their patient comfortable. She had a poor experience of this when she was admitted to hospital several years ago. She wanted to have her husband with her for comfort and reassurance, but was instead separated from him. I was really nervous and really uncomfortable, she told 730. Michael and I really love being together because we are like magnets, we can't let go from each other. Intellectual disability refers to a person having cognitive differences which can impact their ability to carry out some everyday activities. People in this group may communicate in a variety of ways, including via speech, communication devices, or body language and behaviour. Professor Troller said a repeated pattern he has seen is clinicians overlooking what a patient is expressing because they assume it is related to their disability instead of the underlying medical condition. Misinterpreting like this can have dramatic consequences, he said. He said adjustments needed for people with intellectual disability include longer appointment times, adapting communication styles, and taking feedback from trusted support people. It was also critical, he said, to understand a person's baseline, such as their typical behaviour, eating habits, or how they express themselves because changes might point to a condition that required further investigation. Making training mandatory. The Health Ambassador program costs taxpayers approximately $350,000 a year. That funding was not being extended. However, a spokesperson for National Disability Insurance Scheme Minister Jenny McAllister told 730 the Health Department is now considering a plan to continue funding the program for another 12 months. I'm just going to stop there for a second. Why does it have to take things being reported in the news and on television? I know that sometimes is the only way that things can change. But boy, it's really sad when it has to get to that. Back to the article. The government has also invested $4.7 million over 4 years to develop resources to train medical staff. Advocates said those resources were not being used. All the know-how to train and equip current and future health professionals is there, Professor Troller said. What we need now is for people to implement it and make it mandatory. Jim Simpson from the Council for Intellectual Disability said university medical and nursing courses devoted minimal time to the needs of this group. What we need is for universities to embrace people with an intellectual disability in their curriculums, he said. New South Wales Health said staff are trained to respectfully work with patients with disability, but acknowledged there was always room for improvement. Sam has made a full recovery and is back in the surf, on the footy field and competing in CrossFit. While Deborah and Chris acknowledge many doctors do a fantastic job of caring for people like Sam, they want to see things improve. Along with providing training to GPs, Deborah wants to see the National Assistance Card introduced for autistic people, and those living with acquired brain injuries expanded to include all people with disability. The card is a personalised document that can be used in everyday or emergency situations to indicate a person's support needs. As an example, a card for Sam would reflect he has Down syndrome and a heart condition, but more importantly his baseline levels such as usual blood pressure and fitness. The card might also include details of the person's communication style, their likes and dislikes. Or in Sam's case, a statement like, "I'm happy, I've got a good life." Before we close for this episode, there also seems to be a shortage in Australia of dentists that can help those with special needs, private imaging services, specialist doctors, to name but a few. I live in hope that one day no one who is disabled will have to struggle to find the help we need. Till next time, take care and bye for now.